endometriosis can be debilitating, affecting every aspect of a woman's life. The chronic pain, the heavy bleeding, and the emotional distress can take a massive toll. Now, many women struggle to perform even everyday tasks. Some of my clients even struggle to get out of bed on their worst days. Fatigue, anxiety, and depression are also part of the package when you get things like endometriosis. And so it makes it hard to have any energy to do anything that they love, or even spend time with the people that they love. On top of that, there can still also be stigma and shame accompanying this condition. You can feel really isolated and alone, and there's also the issue, the fear factor. So I have clients that come and say that they can't risk going to work, they can't travel on public transport because they're frightened of having a repeat episode of bleeding out through their clothes on public transport and then having strangers tell them there's blood everywhere. I mean, you just can't imagine it. It's horrific. You then also have, you're trying to perform in meetings, for example, and you can't think clearly because you're crippled over with pain. What you want to do is sit there with a hot water bottle in bed and just sleep through it. There's a lack of understanding, there's a lack of awareness from other people. This is a hidden condition. And so, again, the overwhelm is massive. And people who struggle with this condition often feel like they're not understood and they don't feel like that they're ever going to get better. One of the significant challenges we find is actually the problem with healthcare providers who often gaslight, who belittle the women going for help. The women are dismissed. And this is not just from male practitioners. I've heard this countless times that they're women doctors that tell them just to get on with it. Take some ibuprofen, take some paracetamol, and just get on with your life. It can't be that bad. So, again, this can create that circle of despair, of hopelessness, of desperation, making it even harder to cope with those symptoms. When you're stressed, what happens? It creates inflammation, and inflammation in turn leads to pain. So the emotional toll can be overwhelming, and it can be difficult to maintain a sense of self-worth and confidence. But despite these challenges, there is hope. Women with endometriosis are not alone, and there are ways to help manage the symptoms and improve your quality of life. And it's essential to remember that endometriosis does not define who you are. Remember that? The condition does not define you as a person. It doesn't define you. So acupuncture and herbal medicine have been proven to be effective in managing the symptoms of endometriosis and improving quality of life and reducing stress levels and anxiety, improving sleep, etc., etc. Recent studies have shown promising results. For example, one study examined the outcomes of women who sought treatment to help with symptoms associated with endo and found it not only reduced the symptoms of pain, but also significantly reduced the impact for invasive surgery, which a lot of women are quite worried about and quite scared about, especially if they've had it multiple times already. You can look at your diet, you can adjust your diet and reduce anti-inflammatory foods, increasing fish oils such as omegas 3, 6 and 9, reducing red meat, as for some people that can increase your risk of, increase your inflammatory markers. That also includes reducing alcohol, I know, boo, reducing coffee, again, boo, but sometimes these things for short term, if you reduce them, your inflammation will go down and then you can reintroduce them slowly and not just be completely out if that's your choice. If you want to have a nice glass of wine or whatever, then you can without it being an absolute trigger for an endo flare. Low FODMAP diets are also useful, and some clients use that to help reduce inflammation in the gut. When you have gas in the intestines and in the colon, what that will do is, well, that will then press. So if you imagine all your intestines kind of in here, if there's a bloating and gas, it's going to press on here, and all of this then internally is going to, and this is already inflamed, so this is going to feel even more. So fermentation reduction by low FODMAP is really good to help. Excess gas in the colon also causes bloating further up. Look at your lifestyle, look at your exercise. Are you exercising? Sometimes exercise is not an option because you don't feel great or you're very, very tired. So look at things like Tai Chi, look at yoga, look at meditation and mindfulness. But bear in mind that actually if you're in a lot of pain, mindfulness is the last thing you want to do. So improving your mood, maybe go for a nice walk. Some people really like to do journaling and affirmations. Some people like to be out in nature. Do whatever it is that makes you feel better and help with the emotional toll and the pain and the physical pain. So by incorporating these tips into your life, you can start to take back control of your body and your life. Every woman's journey with endo is unique, and what works for one woman, it doesn't necessarily work for another. However, patience and persistence, and then with the right support, it's possible to find relief from symptoms and live a fulfilling life with limited pain. We're now going to talk about an acupressure point that can be really, really helpful for relieving pain. This is called Spleen. This is Chinese medicine, this is acupuncture. Here's the video. So on my own leg, what I've done is I've marked here, which is the joint line, where my kneecap is here, and then I followed it across, that's a mark there, that's a landmark, and then I've marked the top of the medial malleolus. Now this is my right leg, and then there's 1/3, there's 2/3, and there's 3/3. Now this point is roughly 1/3 down,
okay? What I've also done is I've marked the edge of the tibia, okay? So you can feel that. Now, when you run down, you can run up or run down, but your finger should feel like it wants to sink into a hole around here. It doesn't have to be massively accurate, but it should just feel like the finger wants to hold. And then what you do there is you massage it, okay, for about a minute, okay, this point here. It can be really sore.
But this is especially useful for women who experience heavy bleeding, clotting, or painful periods. So by incorporating this simple technique into your daily routine, especially when your period is due, then you can feel more in control of your body. This in Chinese medicine is called a cleft point, which is a specific point where you have an accumulation of energy and blood that meet. So it's like a junction point. And so we use this for acute pain and also for things like emotional stagnation. We talk about that in Chinese medicine. So we're also blood stagnation. So we're thinking about things like fibroids, about clotting disorders, but pain specifically, dysmenorrhea, irregular menstruation, and of course endo. So press this point and you can feel relief almost immediately from your symptoms, and then you'll feel more empowered because you're taking back control. So deep breathing exercises, visualization, meditation to reduce your stress and anxiety, movement, exercise for moving your energy, for moving that stuckness, and also to release the endorphins that you need to make you feel better. So using the acupressure points as well, it can get you through a day. Many of my clients say that it gets them through a working day and don't need to rely on the painkillers, which is also another problem. You don't want to be on painkillers all the time. Endometriosis can be debilitating. It can be horrific. But incorporating some of these little tips, it can make it less problematic. So we believe in empowering women and taking back control of your health and well-being, and I would love to hear about your experiences, and I would invite you to subscribe, and you can watch along to the next part of the series about endometriosis pain, and there's more in-depth stuff further in my channel, so feel free to subscribe, and bye from us.